Shocking new allegations from a doctor in Washington state who says the medical community in his area deliberately gave people who are unvaccinated for COVID-19 a, quote, lower standard of care than those who were vaccinated. Dr. James Miller wrote that op-ed, and he's here to explain. Doctor, thank you so much for being here. What are some of the most egregious examples of the unvaccinated getting a lower standard of care?
Well, thanks for having me on. The way it was done was this very cynical euphemism of saying we're doing this to protect staff and other patients, and therefore we're not delivering care to these people who are not thought well of. In the Substack, which you mentioned, that I was able to get published through a Midwestern doctor, I describe how that kind of came to be and how I ended up starting a free clinic through my church to start helping people. And one of the patients who came into the clinic was just too sick for outpatient care. She needed inpatient care, but she was unvaccinated. And when I sent her to the hospital, they had available monoclonal antibodies and things that she needed, but she was sent home inappropriately and treated with just such disrespect. She ended up not seeking health care from anyone, including our free clinic, until she was moribund. She couldn't be saved, and she went on to die. After that, our church, our clinic, we bought an oxygen concentrator, and we kept multiple people out of the hospital by just treating them through our clinic and at home. The people who were unvaccinated wouldn't receive reasonable care at the hospital.
Oh my gosh. Why? Why do you think the hospital and the administrators who led that hospital did this?
I mean, I can't mind read. There was just this kind of universal madness that went on, and I just watched it, fall to pieces in front of me. I outlined a few of the things in the Substack I published, or the Substack that was submitted that was published, and it was very hard to explain. I mean, being a rational person and someone that wants to deliver health care, I was really at a loss, and that was what was so hard about it. It's hard to speak of because when everyone around you is participating in something that you know is wrong, and they're your friends and colleagues, and you've trusted each other for years, it's very difficult to watch. And so I can't predict, say motive, but Sure. It seemed like there was just this group loss of reason. But then there was a cruelty to it. And that was the part that really struck me, is just the cruelty and how we collectively as a medical community abandon our oaths to care for people, particularly the vulnerable. And as a trauma surgeon, which I was previously employed as, we would take care of people all the time that we would disagree with. We'd take care of drunk drivers, we'd take care of smokers, whatever the issue is. And we disciplined ourselves to not be afraid of infectious disease. I can't tell you how many, probably thousands of times I've been covered with HIV and hepatitis C blood, but I had to be disciplined not to flinch. And so now we have this virus, and we're supposed to flinch. We're supposed to avoid these people. We're supposed to invert reality. We were supposed to not care for them. The medical school I went to has a statue of the Good Samaritan in the center of it. And suddenly with this pandemic, we were told the Good Samaritan turns the other way and walks on the other side of the street. We were told, it's unethical, it's unchristian to visit the sick. You need to, let your grandma die alone. That's the ethical, that's the Christian thing to do. It was all inverted. And unfortunately, most of my friends, most of my colleagues went along with it.
We're running out of time. You could talk about your op-ed for hours, and we still wouldn't scratch the surface of what it meant. But quickly, you lost basically everything there in Washington state. You moved to South Florida. You were abandoned by a lot of your colleagues. In light of that, Dr. Miller, would you do it all again?
100%. I wish I would have just done it earlier.
Understood. Dr. James Miller, thank you so much for being one of the good guys. Not enough of you out there. We appreciate your time and what you did. Thank you, sir.